pharmaceutical agents that target ion channel activity are termed antiarrhythmic drugs. And most of these drugs have been tested in the basic science lab and have shown some sort of efficacy there, which often did not translate into clinical effectiveness. So this has been hard to determine and to assess. While efficacy may be low on one side, there's always an inherent risk of proarrhythmia. The advances in atrial fibrillation ablation therapy, in particular with the single-shot devices like second-generation cryoballoon, have certainly not provided an incentive to pharmaceutical companies to invest more money into development of antiarrhythmic drugs. Also, both types of therapy, ablation and antiarrhythmic drug therapy, are some sort of primitive. They use a one-size-fits-all approach to atrial fibrillation, and there's some ongoing research and with promising results recently that an individualized approach may be more favorable and fruitful to patients. For instance, there is interesting data on the treatment of obesity and sleep apnea in managing atrial fibrillation, which will result in individualized therapy and treatment approaches. This is very limited. Recent developments have largely focused on so-called atrial selective agents. There has been a very little fruitful evaluation of ranolazine and vernaculant, both substances to treat atrial fibrillation in an atrial selective manner. These have been kind of limited in their clinical effectiveness, and recent developments only comprise one of the new late sodium current blockers, eleclazine, which has currently been tested in early clinical trials.